So, friends, on behalf of My Retired Life Foundation, we welcome you to the another episode of In Conversation with. And today we have a very seasoned person, a very professional and very well-known person in the area of the elder care and senior citizen, and Dr. Sheilu Sreenivasan. Madam, welcome you to the show.
Thank you.
And Dr. Sheilu Sreenivasan is a name by herself. She is an MA in sociology from Madras University. She did her PhD in the sociology from the University of Bombay. She spent a lot of time in the research, in academic institutions, in the publication house. But finally, she shifted her life for the cause of the senior citizen. And in 1995, she started what is called known today as the one of the best institutions in the country today, that is the Dignity Foundation for the purpose of elder care. She is the life and soul behind the Dignity Foundation. Madam, welcome you to the show once again.
Thank you. Thank you once again. Thank you, sir.
Madam, when I look at a profile, I see that you started your life in the research, a little bit of teaching, you went to the publication with the Macmillan. And then in 1995, you shifted to the elder care. So can you please tell us what prompted you to move into the area of the elder
care? Yes, indeed. I was very much focused on academics and research and interested in subjects varying from education, the underprivileged women and all that. Then I had gone to New York for some invitation as a speaker. On my return, I had stopped in Frankfurt. There was a stopover. And there in the airport, I had a very traumatic experience. I found a lady dressed all in white sari in a wheelchair right at the end of the lobby of the airport. So as I neared her, I could hear her babble all sorts of things. She was not making any meaning. I could see that it was a very traumatic experience that she was living through. She was not identifying anybody. She didn't know anyone. And at that state, I went and grabbed her hand. So that sent, and I was wearing myself a sari. And that grabbing her by hand and one look at me, she calmed down immediately. So there was a sense of connectedness with me, looking at me. She felt, because Frankfurt, everyone is white and everyone is wearing very different costumes and dresses, not knowing. She was sort of abandoned in the airport. Later on, from the duty manager, I came to know that she was found in the toilet of the women's section. And she was so traumatized and not at all talking anything sense. Maybe she was talking in Sindhi. I couldn't understand. Nobody could understand over there. So I was myself very traumatized. And then then the duty manager said, okay, please come with me. We will take her to a shelter home. I said, no, I have a flight back. Duty manager assured me, ma'am, your flight won't leave Frankfurt without you, because you are doing a service for us, because she would not stop till when she see you. Therefore, I think there is a comfort level. Please come with her. We'll put her in a shelter home, taken care of, and then our car will bring you back. I immediately agreed. I said, fine. And we went, and all through the journey, about 45 minutes one way, she was holding on to me. And the moment we reached that home and we were guided to a small room, she saw the bed and she was so exhausted, at once she fell asleep. This the trauma of finding such a lady, 88 years old, around that, and nobody there. She herself didn't know any language. So I myself was very shocked and suddenly alerted to a great sense of tragedy. On my way back from Frankfurt to India, I was full of what it is that I should do as a social worker. You introduced me as one. Yes, I have majored in social work for my MA in psychiatric social work in Chennai, in Stella Maris College, where I studied. I had also spent 6 months in the mental hospital in Keel Park in Chennai. So I had a sort of a good familiarity with mental illnesses, with traumatic experience of people, their expressions, and all that. So I was very taken up. And in that journey, Frankfurt to Bombay, I decided I'm going to work for people like her who have been abandoned. I came across the phenomenon of elder abuse, whereby people find themselves at the receiving end of their own children. That is, the children not treating the parents properly. So the phenomenon of elder abuse, I studied a lot, decided, no, I should start an organization, an NGO, a nonprofit. But first I thought I must let my voice be heard. Therefore, I thought, why don't I start a magazine? Not an academic journal, but a popular magazine where normal people like you and I can read. And I was very happy to launch this in 1995, calling the magazine Dignity Dialogue. That is, I had associated senior citizenshood with dignity. There is one value all older people really care for while they are old is dignity. It's not the name, fame, money, or position that one is looking for one in old age, but it is the sense of dignity, standing on our own legs, not dependent on children. A sense of self-esteem and self-respect is what I thought defines a senior citizen. That's how I call the magazine Dignity Dialogue. The magazine, 4 5 months after launching, it had quite a vast subscribership of 4,000 people in that short period. And slowly I started getting letters from everyone. That is fine for you, Sheilu, to write articles, print and publish. In fact, you are preaching. Why don't you actually come and meet me? I am alone. I'm suffering from loneliness. Another person said, I am very able. I don't have anything to do. I want a job. Like how you said, you were looking for a second career and you started a venture in that area. So it is very much a felt need for senior citizens to be wanted by the economic mainstream, to be feeling wanted. I think to feel irrelevant is a shock for anyone and everyone. For example, in a gathering of about, say, 100 people, or we go to weddings and we find ourselves not being attended to. That is being not being cared for, not being looked after. So that is the immediate emotion that I was trying to address. Sorry, you told me keep my answers short. I will henceforth. Yeah.
Thank you, madam, for that great insight. I'm sure that you have told this story earlier also, your great story at sensitization at the airport.
Yes.
That's a great story, great motivation for others also. We are not sometimes we are also not sensitive to the people. We should also become sensitive to the people, not
Yeah,
only to the elders, but even to the other people who are in need of sensitivity.
that's right.
Madam, I have tried to look at the Dignity Foundation profile. You have been doing a great service. You have got various initiatives like Dignity Care, Dignity Helpline, Dignity Chai Must Centers, Dignity Dialogue. Several initiatives. Can you just briefly tell our audience some of these activities in very brief?
Sure. Thank you. Dignity Dialogue, that is the very first service that I started, whereby people get a platform to express. We we cannot publish in Times of India, Indian Express, but we do want a platform. Therefore, that is the first service I introduced. Profiling older people. In fact, when I came out with the very first cover on the Shashti Aptaburti, completion of 60 years, lot of reaction in the press. Oh, nobody has ever talked about a senior citizenhood. So, in fact, Times of India gave a third page, half a page devoted to my magazine and why I started and things like that. That was the first one. Soon after, people started writing to me, we are lonely. Therefore, I started Dignity Companionship. That is training some of our members in social counseling. Very simple, friendly chat. They will go to the homes of people who are lonely, who are calling us. That is Dignity Companionship. Dignity Helpline, where people will call and say, my son is abusing me, daughter is abusing me. I've been taken over by the property that I had. And so what do we do? So I set up a legal system whereby free of cost, we were providing the legal services for such people abused by their children. Third, Dignity Second Careers, where people were looking for jobs. So the company ICICI Prudential, at that time, Mrs. Shika Sharma was the managing director. She was very much taken in by this service. She said, Sheilu, we will support you. Let's launch a website and all the retirees can upload their CVs onto this website and various companies will find them suitable. And thereafter, a lot of members, very restless. We want to do something very useful to society. So in a chance meeting with the municipal commissioner, Mr. Girish Gokhale, he came up with the idea, Sheilu, why don't your dignitarians, as you call them, help the Mumbai Municipal Corporation by every day taking a walk in the locality, talking to my sweepers, talking to the municipal staff, because they also need motivation. If members of your organization were to come out and talk to them, there will be a sense of feeling wanted. And somebody is even listening to us. They want to know who I am and all that. So let's launch a service. Dignity Civic Service was launched, and 663 members of our foundation served the municipal corporation. To an extent, rupees 800 was paid to each of these members. And so it was a very successful one. So like that, one after the other, nearly about 11 new services I had launched. Dementia was another discovery for me. People suffering from memory loss. So set up daycare center. And in 2006, I thought a retirement township is what is called for. Therefore, at Neral, we bought land of about 25 acres and built a retirement home where people are actually living there. In the same complex, I set up very just a few months ago an exclusive building with 80 rooms for care of people living with dementia. And so thus one after the other, in response to the felt need of senior citizens, Dignity Foundation grew very organically. There's nothing was thrust from top. To the felt need of senior citizens, we came up with this service and other service and other service. That is the really how Dignity Foundation grew.
Great, madam. I think the great service you have been doing. Now, about this NERL project, how many people are staying there at this stage?
Yeah, about 140 people are there. 140 people are there. Yeah. Majority of them are independent, just like you and me. Many couples are also living there. There are also 50 people living with dementia. So there is an entirely set up with the psychiatrist, psychologist, doctor, attenders, nurses. So that's a big setup taking care of people with dementia.
I would like to go and visit there after this
Please.
Omicron and site. Yeah.
Yeah, certainly. In fact, you tell us, I have a bus with which can accommodate about 17 people, 17.
Okay.
So, in fact, you are not very far. We can even do 2 trips to cover your entire membership. Yeah. And do let me know, yes, after Omicron all dies down, and most certainly I will be there myself to welcome you all, and do come and share maybe insights you will have. You might say that, Sheilu, I think you can do this, you can do that. Some type of a collaboration can also take place. We don't know. We'll wait for that time.
Yes, great. We look forward to that occasion. Madam, you have something called an Anand Dan also.
Yeah.
Something I saw it on the website.
Yes.
What is that?
So, very poor people living in slums locations. So we continuously keep visiting slums. We provide ration once a month, about 1,500 rupees a bag, consisting of various items: chawal, gehu, atta, rice, then cereals, sugar, tea, coffee, all put together about 25 kgs. And we give this, so we give up to 500 people every month. So this is a service. So Anand Dan. So people donating, there is a certain Anand. People who are receiving, also a certain sense of self-esteem and self. It is not very easy to receive. It is easier to give. Therefore, a certain mental mindset has to be there for people to even receive something given to them free of cost. So there is a certain talk and a motivation and a conviction that we bring about before we start distributing the ration every month. That is Dignity Ration, calling it Anand Dhan. Yeah.
Madam, I also saw a very interesting concept, and I saw a large number of people involved, something called Masti Chai Center.
Yeah, yeah. Chai Masti, as we call it.
Chai Masti.
So have a cup of tea and have Masti. Enjoyment, listening to new things. It could be entertainment. It could be cultural sharing, celebrating a lot of festivals together, coming up all dressed. Senior citizens don't have avenues to go out. Where can we go day in and day out? So I thought, okay, every day let's have the meeting, Chai Masti. Every day, religiously, in all the 40 centers in the country, Chai Masti goes on. Have a cup of, so Now, of course, everything online. Before that, in physical center, have a cup of tea, and then starts various activities and enjoyment and celebrations together. So instead of calling it dignity evenings, dignity recreation, we thought, why don't we give it a lighter term, chai masti? That is the simply bonding, social bonding.
Good.
This is one thing, Dr. Sengupta, I would like to stress. I think foremost of anything, those of us who don't have to worry for our 3 meals a day, the next important and necessary thing is really bonding, social bonding. Otherwise, we get isolated in our little, in our cottages, in our rooms, and not meeting anybody. Whereas every day, if you come and meet up with other people, a lot of very good can happen. So the social connectedness, in one of my very early research on, I found it is very useful and necessary for senior citizens. That's how I formed this grouping called Chai Masti. In fact, there is even a membership because there is a certain cost. So it is not a free service. There is a certain cost of 3,000 rupees per year. And you can come to this physical center. We bring very many speakers and performers, entertain, and for the learning pleasure of senior citizens.
Great,
Yeah.
great. That's a great networking activity.
Yeah.
And I totally agree with you that, that whenever we have also tried to do some research in the area of the senior citizen, we saw three things are very important. How do I keep myself physically fit?
Yeah.
How do I keep myself mentally agile? And how do I keep socially connected? They are all the, you can call it the
Absolutely.
three vertices of an isosceles triangle.
Absolutely. Absolutely.
And
Yeah.
all are equal.
Yeah,
Right.
very well put. Very well put. That exactly it is. And I'm so happy to see that your organization, very similar to ours, and promoting social bonding and getting to know each other. And you said, in fact, every member gets an opportunity to talk about themselves. So in all the 40 centers, in their own small group, they do that. But when all India programs are held, when all 400, 500 members come on to the Zoom, there we have only cultural programs. And at that time, people do not talk to each other. They listen to the performances and programs.
I know. It's not possible also. 500
Yeah.
people.
That's right. Yes. Yeah.
Dr. Sheilu, now the next question naturally arises is you're doing a lot of things. So what is the next landmark? What is the next plan?
Yeah. Landmark is, I want to spread. Now we are in total of 7 cities. I want to make it 14 by end of December 2022. The more number of cities we reach out, the more members, of course, and every center gets saturated. For example, Navi Mumbai has only these many people. There are 60, 70 people, that's all. The opportunity to grow larger doesn't come unless we reach out to a newer place. So that is my lookout for this whole year. And our efforts are on in identifying who is there. Fortunately, my magazine subscriber group is there. Magazine goes to so many cities, and we have written over there, we want to start a chapter, so please write back to us. And therefore, we are hearing from people. We will be shortlisting these another 7 more by 22. We would have started. So more number of people into the fold, dignity.
Great. That's a good idea.
Yeah.
Now, Dr. Sreenivasan, let us shift our gear a little bit to the general elder centric issues a little bit,
Yeah,
because you are an expert. You have seen so many senior citizens, starting
yeah,
from the Frankfurt lady till today, 25 years, more than 25 years of
yeah,
experience of
yeah,
serving the cause of senior citizens.
yeah.
What do you think are the main problems of the senior citizens in the country? If you have to classify and if you have to do some sort of a ranking, the one, two, three, what do you think are the top three problems of the senior citizen as an
Okay.
expert?
Yeah. So when we talk of any population, whether it is age segregated or whatever, there is always the great divide between the well-to-do and the poor people. Therefore, the poor elderly have one set of priorities which need to be attended to them. Topmost is the health, which is very, very logical. And the cost of cost of medical care has been going up steadily, and people are finding it very difficult to even have a basic health maintenance. And in this corona situation, this has even got worse. Therefore, health infrastructure, the government coming up with free medical treatment for up to about uh, 70 million elderly are there who are poor. So it is a very huge responsibility for the country, for the government to undertake, but it needs to be undertaken. That is number one. Number two, food. There is another, there is among that 60, there is 40 million, 30 to 40 million of them do not have 3 square meals a day. Therefore, provision of food, whether the government comes up with various innovative ideas like, having a enormous uh, donor database and having them adopt poorer people who are elderly is one idea, but the government definitely has to undertake that. And the third one is setting up recreational centers. Yes, you and I belong to the middle class, and therefore we can afford to rent a place and bring speakers and all that. But for poorer people, where do they go? In the community, in fact, in a poorer, in a slum location, the older couple has got to be the last people to consume food. That is the customary practice. The man of the house, the man who is earning, he eats first, then the wife and the children, and then only come the elderly couple. Therefore, provision of food, very healthy, nutritious food is very necessary for the government to undertake. So these are the some of the issues that I find that the government has to take. And in fact, I have been in the national policy forming the draft rules and all that, but ultimately nothing gets implemented. They're all their beautiful policy, national policy of older persons. If you see that document, you will find, oh my God, what an ideal situation. Senior citizens in India must be really living in the seventh heaven. That sort of a document it is, but implementation, we have yet to see lot more that needs to happen. Yeah.
Yeah, nothing to agree more on that. Actually, if you look at the 1999 policy, or if you look at 2011 policy, it's
Yeah.
one of the best policies in the world, just like Constitution. It's one of the
Yes.
best
Yeah.
policies in the world. But
Correct.
implementation, yes, that's a
Yeah.
big problem on the ground actually. And as rightly tell, the basic things, the medicine, the food, and the recreation centers where the elders can meet,
Yeah.
possibly can be the three things which the government should look at. Now,
If I may interject here, there
yeah, yeah,
are
please.
6,000 organizations and associations of senior citizens in the country. So the government can very well call upon them to help the government in implementing many of these. Supposing your organization were to be entrusted, Dr. Sengupta, you please undertake this particular, take care of these 1,000 elderly who are living in Navi Mumbai, and we will provide you the financial for looking after, but the work we would like you to do. Won't you welcome such a move?
Absolutely, absolutely.
Yeah. So
That rather,
the government has to be very dynamic and take the help of people who are already in it. But I don't see that happening.
in some state government possibilities happening, where a
Uh,
little bit they are more progressive, because it is more of a state initiative
yeah.
rather
Yes.
than the central government taking an
Yeah.
initiative.
I agree
But
with
in
you. Hmm.
many of the states, we see that the seniors are not in the priority list of the government. That's the
Yeah.
biggest problem,
Yes. Yeah.
because they're neither a vote bank,
Yeah.
nor they come in any way. So it's a problem actually. So
Yeah.
therefore, and then they don't have a voice also.
Yeah. That is true.
They don't have voice also. They don't speak up also.
Yeah.
So
True.
naturally, so there is a big problem as far as the senior citizen go.
That's correct.
Madam, I've got one more question,
Yeah.
and probably that can be the one last question, or one more before the last question.
Sure.
That you talked about setting up the Dignity Foundation. You talked about three top problems of the senior citizen of the country. Now, if somebody has to ask you as an advisor to the government of India, that what are the one or two things they should do immediately, what should be your response?
Yeah. So the health infrastructure, this is something that they can, the, the government needs to ask NGOs, they need to ask institutions, give us a helping hand. That is what I would like the government to do. There are any number of people and organizations willing to do and waiting to do and deliver services. But for the government has got to ask and allocate, okay, this is the certain area we would like you to take care of. So that needs to happen. That is number one. Number two is that for increasing the recreational facility areas, locations, the government has got to step up. Where is thinking cap and come up with identifying many locations. For example, there are so many huge multi-storied buildings. There, the government or the municipality can definitely say your basement should be used for at least 2 hours for the senior citizens in that location. So, lot of initiatives are to come up by the government organizations. This is what I'll be very happy to, if if I am asked by the government, this is what I'll tell them.
Good, good.
Yeah.
Government, for example, government of Maharashtra has been quite progressive as far as
Yeah.
this thing, because I see at least in the New Bombay,
Yeah.
every ward has got a small senior citizen dedicated space. The problem is that there are too small space. Hardly 10-15 people can sit there conveniently, and the facilities are not there. But at least
Yeah.
a free a place is available, which is given by the Navi Mumbai Municipal Corporation. So
I see.
that's a good thing they have done. It was all the concerted effort of the various political parties,
Yeah.
So that way, that is those are, many of them are of course locked, but some of them are functioning very, very well actually.
Oh,
Some
okay.
of them yeah, they're functioning very well. At least we see
Mhm.
that some 10-15 people sitting there gossiping there. But the problem is that nobody is to manage them.
Ah,
Many of them are locked. Many of
yeah.
them stay
Oh,
locked.
oh, okay.
Yeah, because nobody will take the responsibility of managing, opening key,
Yes.
staying there for, let's say, 5 or 6 hours, getting
Yes.
the place cleaned,
Yeah.
those are the problems which we are facing. Otherwise,
Yeah.
we see that in New Bombay particularly, I mean to say, the local setup is taking a little bit of initiative, all
Yeah.
these things.
I see. Okay.
So, madam, I think it was an exciting thing to talk to you. We learned a lot, and
Yeah,
we are sure that we will stay in touch,
yeah.
and
Thank you.
we will do
Thank
something,
you.
work together.
Thank you
Let us
very
look for
much. Yeah,
welfare of the elderly people.
my standing invitation to your organization to come to Nerul, spend half a day with us, see the facility, have lunch with us, meet with the residents. I'll be very, very happy to welcome you. Thank you, sir.
Thank you. Thank you. Thank
Thank,
you very much.
thank you.